Mark, good to see you. Thanks for making a bit of time to come and have a chat with me. I want to kick off by asking you about something that you mentioned when we were talking last, which I thought was a really interesting thing to base a business on. You said most people don't believe in science. I think it was most people or lots of people don't believe in science. I mean, why do you say that? And how has that influenced the way you've built your business?
Yeah, so I think people are skeptical of science, and I think a
Some
lot of it
people
is
are.
based,
Yeah.
yeah, I think a lot of it is based on the fact on how it's presented to people. So I think that they may be told one thing, but they may be experiencing something very different. And I think it's affected my business in that way, right? Is I think intentionally, I want to make sure that we're taking in consideration what are the people that are using my platform observing, and making sure we're aware of that.
So just explain then, I mean, how that works in practice. I mean, how does your business do that for people? Because it's one thing to say, it's another thing to make it happen. I mean, you're in the process of making it happen, aren't you?
I am. So one way it does happen is first being aware of what people are observing. So getting out there with people, understanding what are the things that disrupt their everyday behaviors. And so the platform is speaking to that. So many times in the past, when it comes to health and when it comes to weather, it's a side note to people. But really focusing on how this can affect the behaviors they do every day with this platform, it really helps them to understand why they should take action. So we're doing that by taking in consideration the things that affect a person's environment, specifically the environment when it comes to weather, air quality, humidity. We think about the disease that may be in their environment as well. So taking all of that together and providing an opportunity for them to understand the risk of that environment, now they can make a decision.
Okay, so and just to give a practical example, I mean, before we came on, I mean, we were talking about the heat advisory that is near where you are on Rhode Island. I mean, just explain how, I mean, give people a practical example of how you help people deal with that.
Yeah, so most people might see that alert. They may get it on their phone, they may see it from the weatherman on TV, but they don't know what to do with that information.
Mm.
So what we're doing is helping them to understand how it could affect their health. What are the things that will actually happen to them if they're out in the heat too long or if they're around the humidity too long? And this allows them to be able to understand what's a safe amount of time in this weather, or the person that they're with that they care about. So it helps them to maybe to make a smart decision about their exposure in the environment, and also it allows them to understand if this thing is happening to me, it could be because I'm exposing myself to the environment.
Mm. Okay. And just to pick up your point there, I mean, it seems, and tell me if I've got this wrong, but it seems to me that part of what makes that work is that people trust the information that you're giving to them. I mean, have I understood that correctly? I mean, is that one of the underpinning issues? Is that people believe it and think, okay, this is what it's saying, and therefore it should be true or true-ish.
That is absolutely true. I mean, I think the culture globally now is, especially when it comes to social media, is no one knows what to trust.
Yeah.
And now with the advent of AI, it's even harder to know what to trust. So I think the goal is using trusted and verifiable sources of data that people are already used to using. So we'll start with the platform I'm using currently is only in the US. So I'm using sources of data that people are already using in their daily life. So we use Google APIs. I use the National Weather APIs. So it's things and information that aligns to the data they're already receiving. The only difference is we're taking it and putting it together. So now they're getting a single view of all that information, as well as suggestions of what they can do with that information.
Okay. And you talk about global sort of environmental health intelligence. I mean, what does that mean in terms of scope? I mean, what's in scope and what's out of scope? What's
Good
covered and what
question.
isn't, if you see what I mean?
It's a good question. So currently, with the model in the U.S., we are looking at disease burden, I'll call it. And the disease burden that we look at is what's in the wastewater. So during COVID, that's one of the places we look for signals of spread of COVID. So
Right.
right now, we get API reporting on influenza-like illnesses, for instance, based off of wastewater reporting. We also look at the ER visits in the hospital. What percentage of that is due to influenza-like illnesses? I'm in the process of also adding additional data for gastrointestinal diseases. So there's respiratory disease burden, and there's also gastrointestinal viruses and things that people could contagious that people can catch. So they're going to want to know that. So a lot of it is seasonal. and some of it is not. So it's important for people at least to be aware what's happening in their area. So again, they can have information to make a smart decision on whether or not they want to be in that environment.
Yeah. I mean, I imagine it must have been a bit of a challenge to get all of that up and running.
Yeah, I mean, that's probably why I started the company when I did, which is in December of last year. Because in the past, we didn't have the ability to take all that information, process it, be able to create an algorithm to understand that information together was a lot more work. With the advent of the AI agents, it condenses that amount of work very, very small, and now allows me to be able to provide this type of solution that could benefit people's health.
And just you mentioned AI. What's the role of AI in this context then? I mean, just talk us through that.
Yeah, so I think one of the roles AI plays is in the algorithm. It helps to be able to identify the patterns as well. So it's not enough to just tell us what's happening now. The goal of Orbient as a company is that we're able to predict these types of things. So we can start to see patterns in weather conditions, and environments that could lead to a spread of a certain disease, or that could lead to an outbreak of certain mold funguses and things like that. So it's important to be able to use all this data in a way that can be predictive. So that allows people to plan, allows municipalities to plan, and companies to plan.
Mm. And to what extent is, I mean, to what extent will you be able to address the problem, if you see what I mean? I mean, for me to explain that a bit more clearly. I mean, in the UK, we've had a heat wave, and there's been a given number of additional deaths as a result of that heat wave, which is presumably people that haven't really taken the necessary action to look after themselves. I mean, I don't know whether that's totally true, but to what extent will your platform help solve that kind of problem in the US? I mean, how much of a dent are you trying to make on this issue? I mean, how big is the problem anyway?
That's a good question. It's a very large problem. It's not just a physical health problem. Some recent studies that just got released, I think last week, showed that it also affects mental health. So heat and mental health also have a connection. So the amount of people that it impacts is a large amount of people. In the US alone, I think the goal is not just to inform, but to also change behavior and action. So I think the first step is getting people to understand how this affects them, and then providing the reason they need to have urgency to change that situation. Something as simple as inside your home environment. A lot of people are not aware of the things that they're being exposed to in those environments. So this solution also touches that as well. It's not just external and what's going on in your environment outside, but also in your internal environment through the use of air sensors and other information. We can provide guidance to people to think about their environment at all times.
Okay. I mean, that must create huge amounts of data.
It does. That's one of the first concerns I had when I started this company is uh, managing data is very expensive. So
Yeah.
that's one of the things is why I think the predictive model works better, because it allow us to be able to create models to base things on. So even though there's not a one size fits all solution for every person, there are a lot of similarities from person to person. And so by leveraging those similarities, now we can be able to inform people through a network, right? So I think about a future where wearables can be connected to this solution. And so now I can be able to identify where you're at. And so I can inform other people in that same area of the same threat that you're facing versus having to wait to get the signals back from them.
Right. Okay. So you decide that you're the person that's going to fix this problem. I mean, what happened then?
Yes, I think this is not a single company or a single person solution. What I've learned as I've gotten to this industry is that there's a community of people that already exist here, and all of them have been very helpful to help me understand that this is an ever-changing industry. The threats are always arising, and the challenges are great because it's not always something that's prioritized. So that's the key, I think, is, and this is one of the business models I'm using, is being able to make sure I can integrate into whatever solutions that are out there. So when it comes to air sensors, I'm making sure I can integrate into those. Any type of wearable, making sure we can integrate into those. The goal is access. The more people that can access this, no matter their income level, the more people we can help. So that's the goal for me, is really being able to provide the information to the people that need it the most.
Mm, I mean, your point about access is well made, I think, because it's always the most deprived people in the society that don't have access to that information, isn't it? So you're trying to address that. I mean, certainly that was one of the issues in COVID in the UK. I mean, poor people, for want of a better way of describing it, suffered more than wealthy people.
And
Um,
it still happens today, right? You think about healthcare, especially in the
yes,
United States, it's not very accessible for many poor people.
yeah, yeah, no, absolutely. And in terms of the journey so far, I mean, what sort of critical turning points have you had to face up to?
Yeah, I mean, because of my experience being a digital product leader, I've got very comfortable with failing. So right from the start, my initial thesis of what I wanted to do as from a clinical perspective for this company, after I taken on an advisor, it helped me to understand I needed to change and shift. So originally, I was looking at something very narrow when it came to some issues that happen in hospital settings when hospital acquired infections, but it helped me to understand the need to look more widely at respiratory illness and start there. And then I could build and add these other areas, niche areas in the future. So right now, that's the goal, is that from a clinical side, we're going to focus on respiratory illnesses because they're probably the most in need of a tool like this,
Mm,
especially when it comes to in their home.
yeah, yeah. And what sort of challenges do you, I mean, you've had to deal with those things along the way. What sort of challenges do you think you're going to face going forward? Because
Yeah,
you've actually got quite a big agenda, I think, haven't you?
yeah. I think the biggest challenge I face is making sure I'm not my biggest problem. So the scope of this can get very large very quickly because the application of a solution like this can literally go anywhere.
Yeah,
Schools,
yeah,
military, college, everywhere you can think of where there's air, there's a need to have an understanding of what's in the air. When there's an environment, there's a need to understand what's in the environment that could cause problems for someone's health, and that's kind of the expectation, is that this can be used for that. And so I've met with several federal agencies to understand what the opportunities are that they're seeing, and making sure that I'm aligning my strategy to that.
okay. And what particular opportunities are you looking to explore?
Yeah, so right now we're looking to start a study for respiratory patients, like I mentioned, and that's going to help me apply for FDA approval, so that this can be able to be used in hospital settings and clinical settings.
Right.
So we can be able to take in things like patients who have immunocompromised, maybe cancer patients, people where understanding their environment is critical every moment of the day, not just every day. So that's the first step. But in parallel, have the ability to be able to go into hospitals from a facility perspective and be able to help them understand the health of their facilities. And then there's pharmaceutical manufacturing, there's radio pharmaceutical, there's nuclear operations, there's marines, like boats and commercial vessels where they have to maintain air standards. But again, air is just the beginning. The goal with my company is about the environment. So air is just one of the signals that I'm looking at. The goal is that we can understand all the signals in an environment to provide a full scope of what it could potentially be at risk of someone's health.
Yeah. Yeah, that's a big ambition. I like to see a bit of ambition, but that's a big ambition. And how will you know when you've been successful? I mean, what's your how, I mean, I was about to use the word measure. I'm not sure measure is the right word, but how will you make it, how will you what will make you feel that you've been a success?
Yeah, no, I think you're using the right word with measure. I think because I have the background of being in digital product, you're always being measured. So you
Mm,
had one of the things that I had thought about when I started this company is, what is my success criteria? It's easy to identify that in a hospital setting. So that would be lowering hospital acquired infections. But for the individual, I think success looks like people um, thinking about their environment more, understanding the connection between the environment and their health, and taking action. And I can measure that once they start using a solution, but really I can measure it based on the APIs that are out there already. So Google's already has APIs that are slowly starting to connect wearables with health. And so the connection for me would be making sure that I can have any wearable connected to my solution. Might have a solution, disease, weather, where people can actually see now from a grander scale what the risk is. But the goal is to really make that more customized for people once they tie their wearable, and then from there I can see how many people are actually using this. Are we seeing changes in the patterns? Because now we'll be able to look at their biometric data. We can help them understand that they've reduced the risk, and you can be able to see this also, especially for respiratory patients with less admissions and
Mm.
readmissions.
And who's the buyer here? Is it individuals? Is it companies? Is it the government? I mean, I can see why the proposition would help people. Who's going to buy it, if you see what I mean? Because it's something that is sort of, it
Good
operates at
question.
scale, doesn't it? It can't do it other than at scale.
It's a good question. So originally, when I started the company, it was about creating a platform. The platform that Orbient has created is called Tropos, the Tropos OPI, and it was really meant to be started as a clinical product. So the original customers were just hospitals,
Right.
um, and any industry that has to adhere to air quality standards.
Yeah.
But what happened was when I started to dig into the data, I felt like there was an opportunity to provide some of this information for free now before I got my finished platform. That's when I created diseaseweather.com. So the goal of diseaseweather.com is that giving a free view for people to be able to connect the environment to their health.
Right.
And then Disease Weather Plus will be launched sometime later this year. That will be a paid version of Disease Weather, tying their biometric data to it. So their wearable data will
Right.
be able to do that, as well as a survey about their lifestyle and their behaviors. And that will be where I think the real value will be, because now not only are people going to be able to connect at an individual level, once we get into facilities like hospitals, the hospital also can pull that data in and they can see that in their electronic medical records.
Yeah. And I guess if you're an employer or a hospital, I mean, you've got quite a big incentive to make sure that the environment that your people are in is healthy. I mean, you don't
Challenge,
want
you're
people to be
right.
working in an unhealthy environment, do
You're
you? I mean,
right. You're right. The challenge, though, is when you start to get into industry, they start to get concerned about liability. So I think, yes,
okay.
they want to know, but I think the key will be helping them to understand this is their data. This is not publicly available data. So if they do identify a challenge or a risk, it's something that it's just information we're giving. The goal is not, we're not providing any recommendation on what they need to do with it. It's give you the information and you do it with what you wish. And that goes back to the original question you had about science, right? So we're not providing any specific recommendations on what happens necessarily, but what we're saying is that this potentially you're at risk for this thing to happen, and the individual will determine if that happens to them or not. We can't say specifically that exactly what happened, but we want to make sure people for their own wellness
Yeah.
understand what the risk is.
Yeah, absolutely. No, I get that. Let's talk about you being the CEO. I mean, you seem to me to be somebody that likes being the CEO.
I'll take that as a compliment. So yeah, I mean, I think when I look back at my experiences, I feel like I've been preparing for this moment my whole life in terms of my work life. I started off
Sorry,
as
why do you say that? I mean, what makes
yeah.
you say that? Because that's quite an interesting statement, that.
I say that because a lot of the things I've done from a corporate experience has built me to where I'm at today. So my path to this day is not a normal path. I don't have the degrees, the accolades that many people have in this space. I don't have the normal path. I started as a designer. And so as a designer, I realized the need to observe people's behavior and understand what influences them. And so as I progressed corporately, it moved me into product development. And in product development, that is a key factor in product development, understanding behavior, understanding
Yeah.
influence.
Yes.
So as I started my own company, I'm coming in with the mindset of a researcher, of a designer, of a product leader. So I feel like it's a perfect fit for what I'm doing now. I understand the importance of data. I understand the importance of good data. I understand the importance of the experience for people. I understand things that most people wouldn't because I've also worked in healthcare, digital healthcare. So I understand how people can be affected with their mental health when they're going through some challenges with their physical health. And what does that mean? One of the things I really learned as well is we have to think about people who have disabilities. A lot of times that gets overlooked, but that's also part of the experience. You know, some people have disabilities, and how do you make sure you're taking consideration for all these different factors that make a person when it comes to this experience?
Yeah. And how do you see the job? of the CEO? I mean, my take on it, which we talked about in the past, is that the job of the CEO is to figure out how to make the whole thing work. I mean, has that been your experience?
Sometimes I think the biggest job I think a CEO provides is the direction and the
Mm,
vision, and I think it's a guidance. So I think the CEO is similar to captain of a ship. You're staking out what direction you're trying to go. And you hear the term a lot, the North Star. So I
mm,
think as the strategy perspective from a CEO is you're allowing people to understand this is the direction we're headed. We're not there yet, and along the way you're going to learn. So it gives you room to make mistakes, to get better, to talk to people, to figure things out. And the goal of the CEO is to keep course correcting, making sure that
mm, mm, mm. Yeah, no, I mean, it's interesting you put it that way about sailing a boat. You know, that's quite a good way to look at it, I think, actually. And what sort of commitment has this business taken from you so far? I mean, it's hard work building a business.
It's it's uh it's a huge commitment. Right now I'm self-funded. I'm building out my seed round. So the commitment of time is not the issue. I think the commitment of my mind really is make sure I
Mm,
can stay focused on the mission of the company, making sure I'm accounting for my time fully, making sure that the time I'm doing, just like I'm talking to someone like you, what does this mean for the company?
mm,
So I think right now, because I'm a solopreneur and I'm bringing on advisors, it helps me to stay focused to understand where I'm going to see myself 6 months, a year. When do I see revenue? What can I do to improve my product? So I think what I see, especially from a CEO perspective, is I can't do everything. So I have to understand at what point in this growth of the company do I have to really start seriously sitting down and building out a team that works with me. And that's kind of where I'm at now.
yeah, yeah. I mean, it's always that all CEOs, I think, run up against in the early days. They run up against that point when they become the bottleneck. And you can't make enough progress because there's only you to make that progress. And it's that decision to bring people in, which can be quite scary, I think, but can open up lots of doors potentially if you get it right. I mean, if you get it wrong, you can cause more
No,
problems.
you're right, so far it has. It's helped me. I reached out to everybody in this industry. I've even talked to competitors, and everyone I've talked to has been extremely supportive,
Right.
extremely knowledgeable. And what we always end up talking about is how can we find ways to work together, even competitors. How can we find ways to work together? And I think that's refreshing, and especially being in a
Yeah.
space like that where everyone's trying. I think everyone has a similar focus of trying to do good for humanity, but also we have businesses we're trying to build. We're trying to also make money. So it's helped me to understand you can do both successfully, and you don't have to be. You don't have to put the morals aside to do that. You can still be a good person and make money.
Yeah, yeah. I mean, lots of people I've spoken to talk about the kind of the it's a sort of a dilemma about competing and collaborating at the same time, which is it sounds easy, but it's a bit more complicated to do in practice.
I think what helps is the mission. I think we
Mm,
all have a common mission. Especially working in healthcare as long as I have now. When your goal is just to help people to live an enjoyable life and be able to identify ways to do that, that's the mission. Um, people genuinely will step up to the challenge.
yeah. Yeah, that's what's great about them, isn't it? People do that, which I always find amazing. Really. What sort of things have pushed you out of your comfort zone so far?
Operating with a very small budget definitely can get you out of your comfort zone. The other things I think from a comfort zone perspective is knowing that I don't know it all. I don't have the expertise in a lot of these things, so I have to find the people that can provide that expertise, that can guide me. Being able to be humble enough to realize that, but also be confident enough to know that the concept and ideas that I have are generally going to help other people and have some value to be added to society. So I think everyone I've talked to about this company, Orbient, and what we're trying to do has left with the same passion I come in with.
Mm. And one of the other things that happens, I think, is inevitably. you run up against challenges, you run up against stuff that goes wrong, crises, for want of a better way of describing it. I mean, what is it? What is it that gets you through those inevitable crises? What is it that keeps you plugging away?
It's a good question. And I've had several crises. So I can think of during COVID, I worked for CVS, pharmaceutical retail chain here in the US. And I was there during COVID, the early days of COVID. So I remember the unknown and not knowing what COVID was, what the risk of it was. So
Mm,
to be in that space and have to be rapidly changing day to day. So the team I worked with, we were responsible for setting up the testing and the digital side of it. So we had to make sure people could register to get tested, they could know where the locations
mm,
were, and we had to do this for the entire United States with nothing to build on. So every day we had to wait to the president's cabinet met with the leaders of all the pharmaceutical chains in the U.S. and every day we got new direction. So if you think about every state's governor decided how they're going to operate, and so you have 50 different states telling you what they want. So it became a very big challenge very quickly. And at the same time, we didn't have a solution that existed. So we had to figure out what was the solution possibly needed to be, what are the challenges to delivering the solution that everybody's going to be accept. And so as a digital leader in that space, what helped me to understand how to do this is to lead the team by providing expectations that were realistic. And that's the same thing I'm thinking about today with Orbient is what are the realistic expectations that I can
mm,
deliver to?
mm.
Um, Revenue is always going to be an undercurrent, but the real challenge is going to be making sure you can deliver something that people are going to use and want to use. And in some cases, it may save their life.
Yeah. And to pick up your point right at the beginning about some people not understanding science, I mean, I guess during the kind of COVID thing, there was a bunch of people that clearly didn't understand what the science was saying.
Some of them are scientists.
Well, yeah, but
So,
so that kind of it's not only about willingness to do things, it's also
yeah,
about knowing what the right thing to do is, isn't it? Which makes it
yeah,
it's
you're
an
right.
additional layer of complexity.
Well, and the other part of that too is what is right for you, right?
Yeah.
So even now, when it comes to COVID vaccine, some people feel that that's the right decision for them, and some people don't. So whatever side you sit on that, it's they still need to know what the risk is. So when I think about the solution I'm presenting, it's the same thing. Some people take precautions, and some people don't. So the goal is to inform them. If you don't take these precautions, expect these things could happen, and so that way people are still aware of what's the root cause of this event that's being triggered for me, and that's the goal for me is just informing.
Yeah. But what about your point though about it's not sometimes these things are not just about information, it's about a willingness to take risk. And some people are more, if you like, more willing to take risks than others. I mean, what's your take on that?
You're right. I mean, and that's even the same in business, right? I think some people are risk adverse. Some
Yeah.
people are willing to take a calculated risk, and some people just don't see it as a risk. They just feel like that's just the way things. If it happens, it happens. It's just the way things. So they don't want to worry about it. It's too much of a burden to them mentally. So you have to understand that. I think understanding human behavior is a key element in terms of how you can provide a digital experience. This is what I've learned in my experience as a digital leader is it's not a simple one size fits all.
No.
You'll learn that very quickly. And so what I've seen is that you have to be able to take in consideration what are people going through. And the only way you're going to find that out is to talk to the people.
I mean, what was going through my mind was to what extent can you help people understand those things better, if you like,
Yeah, I mean,
which is kind of a learning piece or an
it
education
is,
piece.
but I think and this is what I observed during COVID, community is the way people observe and change their behavior. In many instances, people see what behavior is acceptable, the society says it's acceptable, and whether or not they want to align to society will determine whether or not they adopt that behavior. One of the things I saw during COVID is on Reddit, people wanted to know what it was like to get COVID tested, what it was like to get that thing stuck up their nose.
Yeah,
And
yeah.
that determined how people responded to that, determined whether or not people were willing to go and get tested. And I saw that in real time where more and more people started to sign up to get tested at CVS because I could see in Reddit more discussions about what's that testing like, because it's something that most people have never done in their life. So they wanted to know, and so that encouraged people to do that. And then once they saw other people were doing it, it wasn't as big of a deal anymore. And then it became required, so most people had to do it. So it just helps us. I think it helped me to understand is that behavior can be forced or it can be influenced. And in this case, we're trying to influence it for the betterment of the community, but also for the individual.
And what kind of example are you trying to set as a CEO? I mean, what is the message? I mean, it's not just about the technology, but
Uh,
your approach. I mean, what kind of
yeah,
message are you
so
trying?
I think my approach is one I've used in my career as a digital product leader, which is kind of cliche as a servant leader. So always being open and willing to listen. And a lot of this has to do with the fact that mentors and the people that I worked under had the same approach with me, and that's what helped me to grow. Always being willing to listen, always not assuming you're the smartest person in the room, but also being decisive. I think that's one of the challenges I've seen when I saw CEOs face any real challenges is they weren't decisive enough at the right time.
Mm.
So I think paying attention and understanding the environment and why you need to make decisions when you make them is important, but calculated decisions. And if you're wrong, being humble enough to say you're wrong and course correct. I mean, I think the worst thing that can happen is you're not humble enough to admit you're wrong and you cause the company to fail just because of that. So that's what I'd like to avoid. And I think the other piece of it is, and this is advice I give to people who are coming up in product, is embed yourself in a community. Embed yourself with the customers you're trying to serve, the people you're trying to serve. You only are going to learn if you do that because you'll find out things they don't even know. And I think that is the answer to your question as far as how do you help people to understand that is you have to teach them based on the fact you can say I've been with you, I've seen this happen, and then you can help them to understand when you make these changes incrementally, we can see improvement happen. And that's the goal is that the burden is not to make quick changes, but if you make these small changes, you can have better health.
Mm. Mm. And you seem like somebody that values learning.
I do. I do. I think that's to me that's what the CEO is, the responsibility is you're always learning and you're always pivoting, um, and you're always thinking about new ways to look at things, new perspectives. I think that is why I feel this company would be successful, and why I think AI is helpful in that is that it allows you to take on so many different perspectives at once and gives you a viewpoint that you probably couldn't do as a single human.
Yeah.
It allows you to really understand how you can put that value into your product a lot sooner.
Yeah. I mean, AI does it quickly as well. It's not that you necessarily couldn't do it without it, but it almost does it almost instantly, doesn't it? Which,
Pretty much. I mean, I think that's the goal with my company as well, right? I think it's not just giving people information, but it's giving them information that taking away that cognitive load off themselves and allowing this platform, the solution to be able to think for them, right? So people don't need to think about what's the effect because I had took this medicine or I'm doing this thing.
Mm.
Now they can do all that in the solution. They can be able to be provided recommendations without them having to really think through it too much. And that way, when it becomes that passive, it's easier for it to become an everyday thing. And that's the goal. That to me, that's success. Is that instead of people just seeing the weather on a daily basis, they're seeing the environment weather and understanding that how that affects their health.
Mm. Mm. I mean, that's quite a big change. I mean, that's a
Absolutely.
cultural shift you're talking about. I mean, how
Absolutely.
would you make that happen?
I think it's going to start with the clinical side. I really think that once we get on the medical side, and this has already started, but once they realize the impact that these things have on people's health, it will become easier for the on a global scale for people to realize it's something they need to pay attention to. And I think
Mm.
I'm already starting to see it for air quality, but again, the goal for me is beyond just air quality, but overall environmental health. And I think even though it's a huge cultural shift, because of the shortages of doctors and medical staff, it's something that people can own themselves and they
Mm.
can have control over.
Yeah, yeah, no, and I think I can see a lot of, there's a useful logic to that. Um, I mean, just tell us a bit about a bit more about the journey. So where have you had successes, and what did those successes reveal to you?
Yeah, so the successes I've had so far have been in the meetings I've had. I've met with DARPA as well as ARPA-H in the US.
Yeah.
So the future of what I could do with this platform can go from identifying the known to start to identifying what the unknown threat, like the threat risks are, right? So there are opportunities to identify compound effects, right? So if you think about maybe I have an allergy to a mold, and that mold may be present in my house. Well, maybe it's just a small amount, so it doesn't really register, right? But what about the compound effects of the daily exposure to that mold?
Mm.
So things like that is what I'm trying to identify. I think about and that there's a success in that type of thinking. So the studies I'm trying to do is also showing that is true. That episodically you may not see a threat, but over time you are going to see. And it's a study, like I said, a study just got released that shows this, and it has to do with humidity, right? So it's not just that one day of a hot day, like maybe today I have here. It's that trend of multiple days of heat. What does that do to someone's health? Because they also are getting exposed to higher levels of particulate matter, other ozone, and other things that can cause health risks. So the success is tied to in real time seeing that science, medical, environmental science as well, they're all catching up. The goal is that it becomes accepted by everyday people, and it becomes something that it's just part of their everyday life. Like I said, I think the goal would be that people can see a risk score, and they can get a good understanding whether or not they should stay outside for a little bit or just stay inside for the day, whatever that case may be.
Yeah, and I guess it's a bit like one of those financial health diagnostics, isn't it? Gives you an indication of what you might want to do and what you might not want to do. And what,
Yeah.
just out of interest, what's DARPA? I mean, they're the defense research people. I mean,
Yeah,
what's
so
there? Presumably they're worried about the environment that their troops operate in or something. I
I
mean,
think yeah, so I think that's what people usually think about when you think about DARPA is
yeah,
military. But military is usually the start, and then they usually think about what are the larger applications beyond that. So if you think about threat risks, so understanding threats in an environment is something that's important to anybody. So there's applications there for anywhere they operate to understand what are the threat risks, biological threat risks,
right.
synthetic threat risks, um, and again, like I mentioned, it's indoor, right? So if in the right conditions, you want to know, is a fungus going to now appear here because it's been raining, I have heat. What are the chances that now the fungal spores will start to come and create problems for people's health?
Mm.
So being able to predict that is something that they're more interested in.
Yeah,
So
yeah. And I can see the value of being able
mhm.
to get ahead of the curve on that.
Yeah.
I mean, let me ask you about the flip side. I mean, we've been talking about some of the successes. I mean, what sort of failures have you had, and what have they revealed to you?
I would say from a failure perspective, the biggest thing that I would say is as I'm learning that there is a need for this, it doesn't necessarily have to be medical. And I think the failure for me in the beginning was I was very focused on the medical and
Right.
clinical side of this. But as I started to do more research and talk to more people, the opportunity presented itself that this is something much larger than just a medical or even a personal wellness tracker when it comes
Mm.
to the risk of somebody's personal wellness. The opportunity for me has been open even wider than that. So in some of the future versions of the solutions I'm building, it even goes beyond human threat and risks. And you start to think about things like animals. You have industrial farming. You have opportunities to understand, is there a threat to the food supply because of it?
Mm.
So
I mean, those are
disease,
pretty big issues, aren't they?
there is, and I think, but the same application to humans applies to animals in many ways. You
Yeah.
just change the algorithm slightly based off of the sensitivity to the diseases.
Yeah, yeah. No, I can see, and that's a massive. I mean, that's a massive market, isn't it? Really, I mean, agriculture, because
Yeah,
obviously, I mean,
definitely.
it goes into the human food chain, so it's really important that it's looked after in the right way.
Yeah,
What would
yeah.
you say that building a business has taught you about yourself?
One of the biggest things I would say it's taught me about myself is even though I'm self-diagnosing myself as ADHD, it's helped me to understand the need to focus
Right.
from a daily perspective. So shifting from working a 9 to 5 where you have a calendar, you have meetings, you kind of know what you're going to do day to day. I have to do that myself. So one of the things I did to help me to manage that is to create my own chief AI agent with its own team of agents. And so I literally can go to my laptop, to my MacBook, and I can talk to the agent. And I can find out what do I need to do based off what's on my roadmap. What do I need to be focused on? How many
Wow.
days do I have to my milestones? So it's helped me a lot to understand. Yeah, I'm working by myself, but having these AI agents has been extremely helpful. And I think the climate for that has helped me to understand where my weaknesses are. So it's really forced me to really be more conscious about my time management for sure, and prioritization.
Mm. I mean, that's such an interesting example that I suspect we're going to see a lot more of that as people understand how to do that because it's so valuable, that sort of thing.
Yeah, it goes back to what you said, right? As a CEO, you can't do it all.
Yeah.
So the tasks that I don't need to do myself, like managing what is my roadmap, what do I need to do. So right now, I can just go and I can literally tell the AI agent what my day was like. I can go back and say, I sat for a podcast and got interviewed, and it'll tell me, do you want to do follow-ups? Do you need to do any type of reels that you want to do for the marketing? So it helps me to kind of compartmentalize
Yeah.
the
Yeah. Yeah.
priorities in a better way. Because, like I said, with the ADHD, my mind is everywhere. So I need to help with focus, and this really helps me a lot with the focus.
Yeah. And focus is so important, isn't it? I mean, there's a famous saying, I forget who it's from. The lion only chases one gazelle. That thing about being focused is your only hope, really. You know, you're not gonna you're gonna starve if you try and chase two gazelles, or
That is
three of them would be my take on it.
excellent.
Not that I'm a lion, but
No,
one
that's an
last
excellent analogy.
question.
I agree. I agree.
One last question, Mark, before we wind
Sure.
up. What advice would you perhaps offer to somebody that's thinking about doing something similar?
My biggest advice I give people is to get out there with people.
Mm.
We get so used to being behind computers. A lot of people work remotely. How I've gotten to the place I'm at now is because I've been active in my digital product community, as well as volunteering almost every year. So let's say like the last 5 or 6 years, I've volunteered as a mentor at the MIT Grand Hackathon. So it allowed me to be able to help students as well as other professionals come up with their concepts. And it's not just a hackathon. I mean, there's some major companies that have come out of that hackathon. So to be able to actually go physically, be somewhere, work with people hand in hand, and over a course of a week and help people go from concept to an actual product has
Mm.
been amazing. Amazing thing to witness and to contribute to. But building my community, my network, I would say that's the biggest thing. And seeking out people to learn from has definitely also helped me. Um, as much experience as I have in digital product, I still seek out other digital product people. I still tap into the people I used to work with. I still look for new ways to look at things and new challenges,
Mm.
and not get comfortable with how I see the world. I think so. Making sure I'm also engaging with younger generation of people and understanding how they engage with things, and that helps me to understand again that one size doesn't fit all. You have to think about who is that target and getting there with them to understand what
Mm.
it is that they need, what's the problems and opportunities that you have to help them do something better.
Yeah, Mark, that's great advice, I think, to leave the end of the podcast with. So thank you for that. Thank you for sharing the story, actually. I mean, it's such an interesting area. Um, I mean, I've found it fascinating. I mean, our sort of previous conversations I've found fascinating because it's a particularly interesting area, particularly at the moment. I mean, I mean, we're going through a heat wave here in the UK right now, and I can absolutely see why it's
Europe is definitely
important to
experiencing some
to
staging.
monitor these things and keep keep on top of them, if you see what I mean. So thank you for
Thank
taking a
you.
bit of time to come and have a chat. Absolutely fascinating, and good luck with the next stage of the journey. I mean, I'm sure there's got lots of exciting things that will be happening soon. So thank you for coming on and sharing it with us.
I'll keep you informed.
All right, cheers, Mark. Bye bye.